sorry. Let me backtrack. Welcome to week 7. I just started recording. Welcome to Dr. Lundy's students. For Dr. Lundy's students who have just been entering, please put your name in your campus in the chat. I would appreciate it. So today I'm going to cover chapters, week 6 and 7 topics. We just talked about the PowerPoints and the readings and I like to go through the case studies. I find that the case studies for each chapter that I send you have lots of excellent knowledge in there, especially in the rationales. So I want to cover those. So we're going to cover a lot of ground. So I'm going to talk quick and we're going to keep moving. Anybody have any questions before I start? Everybody knows that the group project, at least the initial post for the group project for this week, is due tonight, right? You guys all know that, right? It's been in the announcements. It's right. We all know that the initial post is due tonight. And then between tomorrow and Sunday, there's instructions in the week 7 announcements of what to do. You should read 2 of them, respond to 2 of them, and then don't forget to submit your peer. I haven't had a lot of people submit the peer. And you know what? I'm okay. I'll send out an announcement. I'm okay with the peer responses waiting till Sunday. I'm fine with that. They don't need to be in tonight. Okay. Just get the main project in tonight and you can do your peer responses and your peer review by Sunday. How's that? Is that fair?
Where did you send that? Did you send another one or do we just use the same one from last time?
Isn't it in the module?
I'll look again. I'll look again.
Professor Lundy sent them to us, Lisa. I can forward it to you.
It's the same one as last time. I can forward
week module.
What?
It's under the week 3 module for us.
Okay. So, I've already had several people submit their peer reviews, so I thought it was in the week 7 module. So Ashley's saying it's back in the week 3 module. So it's the same peer review, but for this project. And I've already seen, it's been really interesting to read the peer reviews so far coming in for this project, because if you compare them to week 3, they're a lot more positive, which is great. For the groups that were having issues in week 3, the peer reviews this time around, positive. So that's good. That's great. That's great news. That means that people are learning how to work in groups more effectively, more competently. So that's a good thing. So any questions before we start? I have to send you an updated, I am going to send you an updated study guide. I sent that to you last night. The error in the study guide was that it's not going to be covering week 9. Okay. So we can take out 7, 8, and 10. Okay. So the new study guide, the only thing that's changed is at the top, it has exam 3 will cover weeks 6, 7, and 8. And not 9. And so if you eliminate 9, you eliminate chapters 7, 8, and 10. But I'll send out a new study guide. I just haven't had time. Okay. That's all does that make sense? That's all my housekeeping stuff. Do you guys have anything? Nothing? No questions? Okay. Cool. Let's get going. All right, let's start with last week's information. Again, I'm going to go through this rather quickly. Okay, where am I going? I'm going to my PowerPoints. Chapter 11. Okay, so what are we going to cover in chapter 11? Chapter 11 is using health education in groups in the community. Okay, so I would like for you guys to read your objective slide at the beginning of every chapter, because at the end of covering this chapter, you should be able to answer these questions. Okay, that's how you know you've understood the content in the particular chapter. So pull up your objectives page. You need to be able to answer all these. If you can't, then either I haven't provided you enough information and you will need to go back into the book and research and read those sections. Make sense? Okay, so take a look at make sure your objectives page is important. And when we get into the book, the objectives in the book at the beginning of the chapter are these, same thing. Okay. Okay, so we know that nurses provide information to enable clients to attain optimal health, prevent health problems, identify and treat health problems early, right? And minimize disability. We know that education plays an incredibly important role in community nursing. Well, nursing in general, but especially community nursing. Okay, so with the education, which is one of our primary roles as a community nurse, right? With the education we give and provide that allows our patients, our clients, individuals to make informed decisions, right? Assume personal responsibility for their health and cope with illnesses should they arise. Okay. We'll cover this in the book, but Healthy People 2020 has some specific educational objectives. We'll get to those in the book. Okay. What are some typical steps? This, again, remember, the PowerPoint is an overview of the chapter. So we're just doing a quick overview and then we're going to go into the chapter. Okay. So typical steps in developing a health education program. We need to understand these steps. Please think of your ADPI. Okay. With every single chapter we're covering in community health nursing, I need you to be able to apply your ADPI. Okay. ADPI in the pediatric hospital setting looks different in the community setting, but it's the same ADPI, it just looks different. Okay. So what are our typical steps in developing a health education program? Well, we have to identify the specific population, right? You need to know who your population is before you can develop a program. Hang on, I'm just letting people in. Right, we have to select our learning theories, which we're going to learn about. What are learning theories? We have to consider which educational principles are most likely to increase learning. We're going to talk about a few educational principles. Pardon me. We're going to examine educational issues. Then we're going to design, implement an education program and evaluate it. Does that sound like your ADPI? Okay,
Yes.
we'll talk about the differences between education and learning. Oops. And then we're going to talk about how people learn. How do people learn? We'll learn three: cognitive, affective, and psychosocial, are different ways that people learn. What do they already know? What do they believe? What culture were they raised in? How well do they understand? Do they have health literacy? Do they have health illiteracy? Sorry. All right. What are our three education principles that we go by? Talk about those in the book. Right. And here's our three, how do people learn? And we'll discuss this more in the book, but there's cognitive, which is your thinking, affective, which is your feeling, and your psychomotor, which is acting. Okay, we'll go through those three. And then what is the educational process? First, you have to identify the needs. Here's your ADPI. Identify the needs, establish your goals and objectives, select, make a plan, select what educational methods you're going to use, implement a plan and evaluate it. Week 6, the 2 chapters in week 6 are about education, health education. Okay. How do you develop effective educational programs? What's your message? What's your format? What's the environment? What's your experience? How do you engage the learners to participate? And then how you evaluate it. Okay, we'll talk about educational issues. We'll talk about that in the book. And we're also going to talk about, this is really important, what are barriers to learning? Okay, what an educator barrier, if you're putting a program together and teaching it, what are your barriers? Do you have a fear of public speaking? Do you have lack of credibility? Limited professional experience, unable to deal with difficult people? So these are a whole list of barriers you may face. Okay, I got a lot of people coming in late here, which is fine. And they're Dr. Lundy's students, so I need for you guys to put your name and your campus in the chat. Dr. Lundy wants me to take attendance for her students. Okay, so please put your name and your name and your campus in the chat. Otherwise, you're not going to get credit for attending. Okay. How has the use of technology in health education emerged, or how is it emerging? Okay. And then we'll talk about this in the book, but if you're asking people to look at the internet for health information or directing them to different websites for different health resources, information, how do you assess that? Have you looked at the website yourself? Is it credible? Is it current? What does the design look like? Can elderly people navigate through it? Can anybody navigate through it? Does it provide good links? I think of whenever I want to look up something health-wise, for me, I use the Mayo Clinic. I find the Mayo Clinic website to be extremely functional and helpful. You pull up a topic and one page leads to the next, and there's more links. And so, whatever you're comfortable with, but I've gone through that website completely, so I'm comfortable referring it on to people. Okay, how do we promote health through group education? Teaching in groups. In the community, you might be teaching an individual, you might be teaching a family, you might be teaching a specific group in the community, you might be teaching the entire specific population. So we have to think about how do we effectively teach in groups. Okay. Have a look at slide 21. Working to effectively educate people in groups. Okay. So I want to read this slide because this is important. Groups can be used to initiate and implement changes for individuals, families, organizations, and the community. Groups represent the collective interests, needs, values of individuals. They provide a link between the individual and the larger social system. Group education can bring about changes to improve the health and well-being of individuals and communities, right? And through effective community education groups, nurses help people identify priority health needs and capabilities and make valuable community changes. Okay, so group concepts, group teaching, group education is an important part because in the community, yes, you will do individual education, family education, but most of your education is going to be groups of people, different populations. Okay, for those of you still coming in from Dr. Lundy's, if you could put your name and your campus in the chat, I would appreciate it. Thank you. Okay. What are some group concepts? What's the definition of a group? What are some key elements of the group? How do they interact? What is their purpose? Are they cohesive? Do they work together? Do they develop norms and have tasks and everybody stays on tasks? What's the culture? What's the leadership? What's the structure? Okay. So let's go to the book here real quick. So we're in chapter 11, starts on page 182. Okay, I have things highlighted. Every time I go through this with a class, I keep highlighting more stuff. So there's a bunch of stuff highlighted in here. And it kind of stops and makes me review with you guys, or at least point it out. Our objectives here, the 6 objectives are the same that were on slide 2 in your PowerPoint, same objectives. So please make sure I'm not going to be able to go through every single objective and answer everything. So you're going to be, I need you to be self-directed to go back after this lecture or whenever you have a minute, go back and look at these objectives. Can you answer these questions? If you can't, you need to. Okay. And then of course, the key terms we know about. If you don't understand what these key terms are, you can click on it and it will take you right where the chapter is, where the term is in the chapter. Okay, Healthy People 2020 starts right off the bat in this chapter. Okay, and they have selected examples related to health education. You need to be aware of these. Okay, they have 4 of them. Okay, what are some of their objectives related to health education? Right? Example, increase the proportion of work sites that offer a comprehensive employee health promotion program. Make sense? Yeah. Increase the proportion of local health departments that have established culturally appropriate and linguistically competent community health promotion and disease prevention programs. Right? So put these on an index card. Every Healthy People 2020 box in every chapter is an opportunity to learn. A lot of this class is formulated around Healthy People 2020 goals and objectives. So you need to be familiar with each. They have different objectives based on the different topics we're covering. These are the education goals. Okay. Right. So one way to think about the nature of learning is to examine the cognitive, affective, and psychomotor domains of learning. So here's your 3 domains of learning. Cognitive is your thinking. Affective is your feeling. And psychomotor is your acting. Let's talk about each one briefly. So your cognitive domain includes your memory. I'm on page 184. Okay, read about these 3. Cognitive domain includes memory, recognition, understanding, reasoning, application, problem solving. Okay. Affective, it's your changes in attitudes and the development. Remember, these are domains of learning. People learn differently. Includes changes in attitudes and the development of values. And we know with affective domain that it is extremely difficult to change deeply rooted attitudes, beliefs, and interests and values, right? To make changes in this domain, people need the support and encouragement from those around them. Do we know people who learn from the affective domain? I do. I have lots of people in my circles that are affective learners. So you can only spend so much time. So, and psychomotor includes performance of skills that require some degree of neuromuscular coordination. So this is that teach back. So you teach a client, you're doing home visits, you teach a client how to change their dressing, right? Then you want them to demonstrate that back to you, right? Or the other examples in here in the book are teaching how to bathe an infant, teaching a new mom how to bathe an infant, and then she'll bathe the baby so you can watch. It's called the teach back method. Changing dressings, giving injections, monitoring blood glucose levels for diabetic patients. Okay, what are you guys? I'm psychomotor. I like hands-on stuff. What do you guys?
I prefer hands-on, yes.
Hands-on.
So hands-on.
So you're in the
Definitely
psychomotor.
hands-on.
Okay. Yeah, I'm definitely psychomotor. Yeah. So those are your 3 domains of learning. Okay. So I put those in a card as well. Put those on a little index card. Okay. Before we do any kind of group, individual, population activity, what do we need to do first? First and foremost, please think of your ADPI. What's your A? What's your A in
Assess.
ADPI?
Assess.
Assessment. Okay, before you do, this goes along with education. Before you do any kind of program planning, you must do a needs assessment. How do you know what you're going to do? Right? How can you plan a program if you don't know what the needs of the community or the person or the family are? So you have to identify what they want to know. Okay. And this box 11.1 goes through the ad pipe with the lens of education. Collect data, obtain information about the needs, readiness to learn, barriers to learning, analyze the assessment data, identify as a cognitive, affective, psychomotor learning needs, right? Think about what will increase the client's ability and motivation to learn, and assist the client to prioritize learning needs. So the first step before you do anything is you've got to do a needs assessment. Okay. And this is a good paragraph right here. Really good paragraph. Factors that can influence a person's learning needs and ability to learn could be demographic, could be physical, could be geographic, economic, psychosocial, social, spiritual, many factors. Right? We have to consider the learner's knowledge, skills, motivation to learn, and resources available to support them, and that may possibly prevent them learning. Resources include printed materials, audio, visual, equipment, agencies, other individuals. Barriers for me or for the presenter may be lack of time, lack of skill, lack of confidence, lack of organizational support. So this is important. This kind of sums everything up. You have to look at all of these things. What if you're teaching a group that is deaf? What if you're teaching a group that is blind? What if you're teaching young kids? What if you're teaching the elderly? What if you're teaching special needs people? Or if you're teaching women, men, college age kids? Everybody is different. Everybody learns differently. So you have to be able to do a really good assessment of what your groups are. Yeah, sorry. Okay. Okay. We just went through that. Okay, so what are our appropriate educational methods? Okay, so we'll try and choose the method that facilitates the efficient and successful accomplishment of program goals and objectives. Assuming you've set out, you've now have your program goals and objectives, what are we going to select for our methods? Right? The method should also be used to appropriately match to the strengths and needs of both the clients and your presenter. Right? We want to choose the simplest, clearest, most succinct manner of presentation. Right? And avoid complex designs. Right? We need to try and vary. So this is an excellent paragraph to understand. We want to try and vary the methods to hold. What if we have people in the group that have little attention spans? What do we do? How do we meet the needs of those learners? Right? Some people learn best by being involved, by brainstorming, by role playing, by simulation, by games, by group participation, by demonstrations, field trips, right? And the list goes on. Okay, for me, I like to just sit back by myself and learn. Okay, I'm not into group participation and group role playing. It's always made me uncomfortable. So I have my own style of the way I want to learn. What about you guys? Do you guys like to role play, brainstorm, go on field trips? What do you like? How do you like to learn?
I'm the same as you.
Just leave me alone. I just want to learn in my own little way.
I have never liked working in groups. I mean, my group now is nice, and don't get me wrong, but in school group, I'm like, nope, I'll work by myself. I'm good.
How about you, the rest of you guys? How do you learn?
I think it depends on what I'm doing. Like if I'm in the classroom,
I'm pretty much a solo learner.
Yeah, I'd rather teach by myself, like for tests and things.
Yeah.
But if I'm in the classroom, I'd rather be with the group.
Yep.
I don't mind doing that.
And that's my point. Every one of you that just spoke has a different way. And that's my point. That's the point of community group teaching. Everybody has a different way. So if you have a group, you have to be able to come to some common ground. Okay, so here's a great mnemonic, box 11.2. It's called the teach, how to effectively teach clients. It's the teach mnemonic. Okay, tune in, edit, act, clarify, honor. Put this on a card. This may be a good definitions question. If you're going to be using the teach mnemonic, what does T mean? What does A mean? Okay. So again, let's have a read at this this part right here. Some of it. When choosing educational methods, we've talked about this. Consider age, gender, culture, disability, special learning needs. Right. And here's where they talk about clients with visual impairment. What might they need? Clients with hearing impairments, what may they need? Language barriers, what may they need? Learners that have limitations in attention and concentration. So this is a great paragraph identifying certain barriers, certain challenges, and what are some suggestions. So have a read at that, page 186. Okay, and then as always, we cover levels of prevention. And this is regards to education, because that's the topic chapter we're on. So we have primary, secondary, and tertiary levels. So for education, let's see, primary says education at health fairs regarding immunizations for children, older adults, and people with chronic illnesses. So prevention, right? We're trying to do education. We're trying to do prevention. Secondary, well, the education at health fairs regarding early diagnosis and treatment of diabetes, along with providing health screenings with the goal of shortening disease during duration and severity. So secondary prevention is your screening. So if you're in the middle of a health fair, you're trying to do screening. Let's say you're doing blood pressure screening, you're doing blood sugar screening, you're doing, what else? You're doing screenings. Why are you doing screenings? Because what is secondary? Early diagnosis and treatment. Early diagnosis and treatment, shortening the disease duration and severity. Okay. And then tertiary, okay, education comes in the form of maybe going into rehabilitation centers or adult daycare centers and help individuals who have had a stroke. And they've already had the stroke. So what's our goal? Holistic care, trying to help them maximize their functioning. So we all understand the difference between primary, secondary, and tertiary. Okay. Shows you if you got anybody's conducting a health fair, gives you some ideas of how to plan a health fair. Okay. This is another great, this is a really good informative resource box as well. It's on page 189. It's how to use plain language in health education. Okay, this is important information to know. Communication with your groups. Organize your audience, choose your words carefully. And look at these bullet points under each of these three. Organize, choose words carefully, make information easy to find. Look at these examples they give. Okay. Don't make it complicated, right? Don't make it complicated. These are lay people we're talking about. Okay, so have a look at that box, the how-to box. Okay, learning strategies for children and individuals with little knowledge. Okay, so here's two different definitions, pedagogy and andragogy. Okay, so put these on a card as well. Okay, so there's two. Pedagogy is for individuals that may have little knowledge of a health-related topic. Okay. Okay, so learning strategies for children and individuals with little knowledge. Okay, so an example would be in this model, the teacher makes the decisions about what will be taught and when will it be learned because of little knowledge about the topic. Learning strategies for adults and older adults with some health-related knowledge, that's called andragogy. Okay, so in this model, learners, you actually influence what you need to know and what you want to learn. Okay. So that's just two definitions. Okay. So let's go to our case study for, see, I've already highlighted a bunch of stuff. That was from yesterday's group. So let's go back and unhighlight it and we'll start over. Okay. So, school nurse provide, and I want you guys to jump in here. I don't care that we can see the answer. It doesn't matter. I want to get to the rationales, which is the core learning. Okay, so this is a school nurse providing education to students, parents, and faculty with the intent of providing individuals and groups with the tools to make informed decisions about their healthcare needs. Okay, health education in the school is aimed at promoting healthy habits and lifestyles, preventing illness, and teaching measures to identify problems at an early stage. An important factor in this process is for the nurse to set an example in terms of weight management, physical activity, and lifestyle choices. Okay, so based on what we just talked about, Robert Miller's a school nurse. He's working in an elementary school setting. What is one of his first steps in creating effective educational program for his students at school? What do we say the very first thing you need to do is? Do a needs assessment.
Identify.
Yes.
A needs assessment, right? It's the very first thing you have to do. How can he create an effective educational program if he doesn't know what the needs are? What are you gonna develop? Let's read the rationale. A core public health principle is asking learners to participate in identifying their learning needs. Okay, then the education programs are designed to meet the need. Okay, so that's what this is about. This is about, in order to develop a program, you have to identify needs. Okay. Now he creates an educational program for the second graders in his school. His topic is related to exercise and fitness. What would be an appropriate educational objective? Okay, well, what is an objective? Okay, the correct answer is C, but why? Right? Because objectives, let's look at the rationale. Objectives are specific short-term criteria that are met as steps toward achieving a long-term goal. Okay, so again, we're in our ADPI here. Does that make sense? Are you guys hanging with me? Does this make sense?
Yes, ma'am.
Yes.
Okay, so you need to know objectives. What are they? They're short-term criteria. So short-term goals to meet the long-term goals. How are you going to get there? Okay. Then the last question is, he's educating the children about health promotion activities. He is obese, and unfortunately, the kids see him taking really frequent smoking breaks. So, which of the following might be a barrier for him? Maybe lack of credibility?
He's not practicing what he preaches.
Exactly. Which is credibility. Exactly, Misty. So, we don't know that he has a lack of knowledge about the subject matter. We don't know that he has a lack of knowledge of how to engage the children, but we know he has a lot, like Misty said, he's not walking the walk. So, rationale. So this question is about barriers. Which of the following might be an educated related barrier? Okay, so that's the question. Lack of credibility. That was in our bullet list of what could potentially be barriers. That was in our second to last slide in the PowerPoint. Barriers. Lack of credibility with respect to a certain topic is a common educator barrier. Okay. The nurse can increase confidence by carefully preparing for the talk so that useful information is included and that the nurse understands the information, right? So, okay. That's chapter 11. Any questions?
No, ma'am.
Let's go into chapter 12. Let's follow along. This is community assessment and evaluation. Okay, so let's shift our AdPi thinking to now, how do we do a community assessment? How do we do a community assessment and evaluation? Okay, and again, take a look at your objectives. Okay, we need to be able to answer these questions. If you're able to answer these questions, then you know you are current on the information, the content of the chapter that covers the concept of community assessment. Okay. Okay, so we know this chapter will clarify community concepts, provide a guideline for nursing practice in the community. So here we try and identify, what does a community look like? Okay, community is made up of people, the place it is, the geographical boundaries, and how it functions, or the activity of the community. I always think of, is the community maybe a college town? Is it an industrial town? Is it a mining town? Okay, what kind of community are you trying to assess? We'll go through this in the book, but looking at community as the whole community as your client. Right, and that's what public health nursing essentially does. You are looking, remember, that's community-oriented nursing versus community-based nursing, right? Community-oriented is when you're, as I've told you before, the way I remember it is you're trying to orient yourself to the community, where community-based is you're already embedded in the community, taking care of the ill. Okay, so when you're doing a community assessment, would you be functioning in the community-oriented role or the community-based role? You're doing an overall community assessment. That's big picture stuff. You would be doing community-oriented nursing, right? Do you guys understand that? I don't care if you're being quiet, that's fine, but I just want to make sure you understand that.
Yes.
If you're doing a community assessment, you are working in the community-oriented mode. Okay? The goals and the means of community-oriented practice, right? So the community nurse tries to seek healthier change together with the community, right? And in community health, there's 3 common characteristics. Put these on a card, we'll go through them in the book. Status of the community, structure, and process. And on slide 7, here's a short definition of each of them. Okay, so characteristics of the community, what is the status? Okay, that involves taking a look at morbidity and mortality rates in the community. What's the status? What's the client satisfaction in the community? Are people happy? Are people sad? Are people angry? Is there a high crime rate? What are the crime rate? Yep, social components. So what's the status? How is the community functioning? Right? What's the structure of the community? What services and resources do they have? Do they have rec centers, YMCAs, parks, places for people to go, bike paths? Right? And then what's the process of the community? Do they have effective community functioning or problem solving? Are there groups of key stakeholders in the community that want to make it better? Right? Is law enforcement working with schools? Are food banks working with families in poverty? Okay, so we need to understand that the community health the communities have 3 characteristics. Everybody has the same characteristics. Everybody has to describe the status, the structure, and the process. But each of those may look different, will look different based on the community you're in. Okay, and then we'll go through some strategies to improve community health. We'll go through some of those. And then here's, I told my group yesterday, slides 9, 10, and 11. Here's your AdPie. Please look at these. This is how your AdPie is implemented in the community setting with community assessment. This is very specific. Look at it all. Just let's go through one. Assessing, right? Collecting data, gathering data, data generation. Okay, then it goes through identifying the problems, planning for them, implementing, evaluating. So please have a look at slides 9, 10, and 11. Okay? Really, because as I've said from the beginning with my groups in this class, you have to be able to use your AdPie and apply it to the different topics we're covering, whether it's health education or community assessment or parish nursing or school nursing, hospice nursing, epidemiology. You have to be able to apply your AdPie in each of these. Okay, personal safety and community practice. We talked about this a couple of weeks ago, and there was even an exam question. Your safety, remember your safety checklist of how to plan for safety during your visits? Well, here's some additional information. Personal safety and community practice, right? Personal safety is a prerequisite for effective community-oriented practice, right? You're out in the community. You're in places that are unfamiliar to you all the time, right? So personal safety needs to be a consideration throughout the process, right? So an awareness of the community and common sense are the two biggest guidelines for judgment. Okay, so what did we just say? Two things: awareness of the community and common sense are your two best guidelines for judgment. Okay, and what are some sources? They identified 3 here. What are some sources that you, as the maybe inexperienced or new community nurse, what are some sources? Where can you get information about the community that you're serving? Well, maybe talk to other nurses, social workers, healthcare providers, people who understand what's going on in the community, maybe community members, PTA people, law enforcement. You know, who's important? Who are the key stakeholders in your community? It looks different in every community. And what are your own observations? Okay. So let's jump to chapter 12, community assessment and evaluation, which we just went through the outline. Am I going too fast, or is this okay?
You're good.
It's good.
Everybody awake?
Yes, it's everything. good.
Yes, ma'am.
We're alive.
Yes.
You're alive and well. Okay. Community assessment evaluation. Okay, we just went through the outline. That was the PowerPoint. Does everybody understand when I say that? This, the chapter outline in the book, is the PowerPoint. Okay? Your objectives are the second page in your PowerPoint. Let's do number 1. Decide whether nursing practice is community-oriented. Is community assessment community-oriented? Yes, we just talked about that, right? Okay. All right, so lots of good words in here. Windshield survey, partnership, data gathering, data generation, community-oriented practice. So, okay. Okay, the nursing process from assessment through evaluation, AKA AdPie, is used to promote community health, right? This process begins with a community assessment, which is one of the core functions when you're trying to get involved and getting to know the community. Just like the last chapter, we said you need to do a needs assessment to be able to identify the needs, to put together community group education? Well, in order to identify what the community needs are, what do you have to do first? Assessment. Okay, you can look through what the definition, according to the book, of a community is. There's a box here. I like this box. Types of communities, box 12.2. Okay, those are different kinds of communities. You can read through that. Okay, so we went through this in the outline PowerPoint, but I want you to have a look at table 12.1 on page 205. Okay, these are the dimensions of the community. The three things: place, people, and function. Okay, so need you to have an idea and be able to identify what each of these are. So for example, let's go to people or person. Let's go in the middle. Okay, what is that? What's the dimension? What are we trying to measure? Population, the demographics. What's the age? What's the sex? Socioeconomic factors. Right? Do they have book clubs, service clubs, friendship networks? Okay, and then on the last column, it's where would we get that data if we're doing a community assessment? I mean, sure, it helps to ask questions, you know, during your windshield survey, but look at all the other places you can gather data. So about the the population, you could get census data, churches, senior centers, civic groups, newspaper, telephone directory, tourist bureau. Right? If you're looking at the place meaning geographic location, what are the boundaries? Is there a local or folk name for the area? You know, out here in Denver, they call us the Rocky Mountain region. What's the size square miles? What are you trying? So measures of what might you trying to be looking? What are you looking at? And then data sources over to the right to get your geographical information, maybe maps. Could be census data, maybe Chamber of Commerce, city, county, libraries, housing. Do you get where I'm going with this? All right, so there's three dimensions of looking at a community. Population, the place, and what's the, I just recently learned that my computer's touchscreen. So I'm trying to get used to touch screening it, but every time I do, it goes all over the place. So I'm in the middle of transitioning from my mouse to my finger. Anyway, okay, so function, what's the function of the community? Okay, what is it an agricultural community? Is it an industrial community? Is it a college community? Right, what's the consumption of goods and services? Right, where might you get what the community is all about? I don't know, State Department, business and labor, local library. Okay. Okay, what are some common community systems? These 9 are typically found in every community. They just look different. So what's the makeup of a community? This would be good to put on a card as well. Right, so these are system categories that are found within a community. Every community has some kind of politics and government, safety, transportation, education, physical environment, recreation, economics, right? It's all going to look different in every community, but these are the basic systems categories that make up communities. Okay. And then it goes through, I'm not going to go through this, it's back up in the box, but if you don't understand the status and the three common characteristics, the status, the structure, and the process, you can read through these here. Okay. For example, community health in terms of a status or outcome is the most common approach. What are the biological, emotional, and social parts of the community? Right, we already went through this. Biological, for example, is measured with morbidity and mortality. This was in our outline, in our PowerPoint. right? We did the definitions. I forget what slide it was, but there was a short definition for each of them. Okay, so the status, the structure, and the process. Okay, and here's a summary of them right here. Okay, table 12.2. What are the concepts of community health? Status, structure. So the status is, what are the vital statistics? Structure, what does it look like? Do they have health facilities? Do they have nursing homes? Process. Right? What is the process, the functioning of the community? Awareness of self and others, of situational definitions within the community. Is there effective communication? Are people working together to make it better? Is there good conflict resolution? Is there participation from key stakeholders? Okay, you guys understand that? Healthy People 2020 is in this format in this chapter, but it's here, 208, page 208. They have 4 goals right here. Healthy People 2020 provides foundation for national health promotion and disease prevention based on 4 goals. Community assessment, attain higher quality, longer lives free of preventable diseases, disability, injury, and premature death. Yeah. Okay, achieve health equity, eliminate disparities, improve the health of all groups. Put these on a card. Okay. Well, any chapter we go through, you need to know what the Healthy People 2020 objectives are. What are community partnerships? What's an active partnership versus a passive partnership? Okay, so I'm right here. So active partnership, right? So an example of an active partnership would be, say, I don't know, a bank in the local community provides funds to buy after-school snacks for kids in the after-school program. Active, direct impact. Okay? Where passive, you may get people in a group that problem solve how we're going to reduce the crime rate. Okay, so you have a group of key players in the community. They assess, they plan, they implement, they evaluate. Okay, and that's passive participation. It's not that it's less important. It's just a little bit indirect, where if you have companies, corporations providing direct support, such as after-school meals, that's an example of active participation. Okay. Okay. Okay, here's what we talk about. Community assessment is one of the 3 core functions of the public health nurse. All right, it's the process of critically thinking about the environment, about the community. Right, and we went through these 3 already. What are the geographic boundaries? Who are the members? What characteristics do they have in common? Okay. So the assessment helps the nurse in the community health to understand individual, family, and group problems, right? And to know what community strengths and resources are available, right? And again, we're talking ADPI. How do we identify needs, clarify problems, identify strengths and resources? How do we assess what the community, what the needs are? How do we collect data? Okay, so know these definitions as well. What is data collection? What is data gathering? What is data generation? They all have different meanings. Okay, how do we collect information from community members? Interviews, observations, windshield surveys. Maybe look on the website, the county website. That's secondary analysis of existing data. Surveys. Okay. And this talks about the best way to conduct a windshield survey is to have a designated driver, at least one other person, so you can scan and outline and take notes. And here's some things that in a windshield survey you might be able to observe. Maybe boundaries, housing, what's open space, transportation, social service centers, stores, right? All these you can do. Okay. And then it talks about how to pull key, I call them stakeholders in your community together, right? Who would be helpful? Who would you like to pull together in your community? Well, here's 5 different categories of people that might be important, right? The health department, church leaders, maybe law enforcement, education people, the head of the PTA, mayor, politicians, maybe a mom who organized a local chapter of Mothers Against Drunk Driving. It depends. It depends. These are some common types of people you would bring in, but you know, every community is different. All the needs are different. You know, if you have a community that has a high risk of suicide among high schoolers, well, you may be bringing in mental health providers, crisis managers, right? School counselors. If you have a community that has a high crime rate, you may be bringing in more law enforcement input, right? If you have a community that has terrible test scores and education scores are below average, well, you may be bringing in more people from the education community. Does that make sense? Okay. And then I think this is the last part of this chapter, how to determine, we talked about this a little bit in the outline, but what criteria can we use to determine the usefulness of websites? Okay. So some questions you might want to ask before you refer on, right? How is, you know, I take my example of the Mayo Clinic website, right? The information is current. The website is always updated. How credible is the data source? I believe credible. All right. So these are some questions. Is data reported about different community systems? Yes. Right? No, I don't see number 7. I don't see any obvious basis in the reporting of their data. They're providing medical information, diagnoses, symptoms, treatments. Make sense? So before you can refer people onto websites, you have to be comfortable that it's a useful website. Okay. Okay. Let's go to our case study. I actually like this case study. This is a good one. Okay. You ready for the case study? So we have Pat Jones. She's a public health nurse who participates in making home visits in a large retirement community. Community assessment of retirement centers within the city limits has been requested by the community leaders. All right. So their goal for the assessment is they want to identify community health problems of the residents and what the strengths of the communities are, as well as the types of resources which will be needed to meet the needs of the individuals. Make sense? That's what a community assessment is. So she starts a community assessment with data gathering through the county website. After this, she goes and does a windshield survey, and she uses the public bus system. Okay. This method will enable her to observe the characteristics of the individuals using public transportation. So this first, okay, so she's going to do a windshield survey. All right. So first question is about the windshield survey. Excuse me. What windshield survey components can be assessed through utilizing public transportation? Okay, well, we can certainly gather how frequently it's available. And we can certainly gather what are the common characteristics of people on the bus. That's for sure. We're not able to figure out doing a windshield survey on a bus, what religious practices are, or what socioeconomic characteristics are. right? Or what the goals and perceived needs of the residents are. Are they happy? Are they sad? Are they happy? Do they like the community? Well, we can measure B and C. And so our rationale is about what a windshield survey is. You guys, I'm telling you, rationales are really good learning tools. They really are. So while driving your car, riding public transportation, the nurse can observe many dimensions of the community through a windshield survey. And here's a list of things you can do. Okay. So then she informant interviews are a critical part of conducting a community assessment, right? Which of the following should she consider when scheduling a meeting? Okay, so these are personal interviews with people. Okay, so I'm going to read the rationale. We know the answer is B. Interviews can be time consuming. So care must be taken to allow time for discussion. Let's read the rationale first. Informant interviews with social workers, religious leaders, or you could extend that out to principals, police, law enforcement, can provide data that describe how well a community is functioning, right? The data can be difficult to acquire without personal interviews. Okay, so that's part of your assessment process, personal interviews. Informant interviews and participant observation are good ways to generate information about community beliefs, norms, and values. Since you can't gather that from a windshield survey, right? You can't gather beliefs, norms, values, power structure, but you can gather it from person-to-person interviews. Okay. So, does that make sense? Okay, the next question is, and this is a good one. How do you gain entry or acceptance into the community? All right, it's perhaps the biggest challenge in the assessment process. What are the associated challenges the nurse may experience? And this is a select all that apply. Okay, so we talked about educator competence. Okay. And we talked about all of these three. Okay, so when you go into a community, you have to establish trust. How do you gather trust and acceptance? Right. Well, the question is asking for challenges. Well, we know that the nurse. Let's read the rationale first. Gaining entry or acceptance into a community is perhaps the biggest challenge. That's a big statement. Okay, so what we need to understand is what is the biggest challenge for the nurse as she goes into a community to do a community assessment. Okay, the biggest challenge is gaining entry or acceptance, trust. Okay, the nurse is usually the outsider and often represents an established healthcare system that is neither known nor trusted by community members. So who therefore maybe kind of react hostile and not sure what she's doing there and kind of mind your own business. In addition, nurses may feel insecure about their skills as a community worker. If you're a new community nurse, it takes a while to get on board. If you're new, any kind of nurse, it takes a while to get on board, right? You have to try and establish competence and trust on the front end, right? The community may refuse to acknowledge the needs after an assessment is done, right? So because of the nurse's success depends largely on the way she's viewed, he or she is viewed. Entry into the community is critical. Okay, so trust, acceptance. Does that make sense? Okay, questions on that chapter?
No, ma'am.
That helped? Do you guys have an idea of community assessment?
Yes.
Let's go. Hang on a sec. Let's go. Can we answer our questions? Can we answer our objectives? We know why community nursing practice to do a community assessment, you are practicing in a community-oriented model. Do we understand that? Yes. I'm not
Yes.
answering for you, but we'll do that. Right? So we understand do we understand selected concepts basic to community-oriented nursing? Right? We have a community. Our community is the client, how we're assessing community health, and how we have to pull key members from the community to partnership with us. Right? Can you all articulate on your own how to apply the nursing process, ADPI, to community-oriented, to how to do a community assessment? You should be able to. Okay? You feel comfortable with those?
Yes.
Yes.
Okay. Okay, let's cover violence and human abuse. This is a hard chapter. Let me go to the PowerPoint here real quick. No, that's not what I wanted. Okay. All right. Violence and human abuse. Here's our objectives. Let's read through them at the end of this chapter and we'll see if we can meet them. Okay. Okay, violence. This is what the chapter is. All right. We know that violence significantly affects mortality and morbidity, right? That's a given. That's a fact. And we know as nurses, we're not just caring for the victims. Oftentimes we're caring for the perpetrators and those who witness the physical and psychological violence, right? We can take an active role in developing community responses, resources to violence through working on public policy and needed resources. A couple of years ago, I was a victims advocate for our local, pretty big police department. So I would go out on calls for situations, domestic situations, a lot of times included violence. So it was incredibly hard, really hard. But when this last bullet, nurses can take an active role in developing. If you can, get involved. There's a lot of stuff that goes on in the community. Social and community factors influencing violence. Well, work. Have we heard of workplace violence? School violence. How does the media play into this? Religious violence. Right? We know, and then it goes to, you know what? It goes through each. So this is the slide. So slide 4. And then each slide after that goes through work, education, media, organized religion. So I want you to read through those. Okay. What factors from work? We'll just go through a couple of them, but I want you, the expectation is that you do eventually read through these PowerPoints. So it's, you can't rely on me to be going through every word of every PowerPoint. I'm just trying to highlight the important content areas. So we know that work can be fulfilling and contribute to a sense of well-being, but we also know it can also be frustrating and unfulfilling. Think about people who lose their jobs or don't get the raise they wanted or promotion they wanted, right? Sometimes this frustration, resentment turns into violent behavior, right? And then education, right? Look at all the issues we have in education, in the schools, bullying, harassment. Look what it's turned into. Okay. Media. Media, TV shows, violent TV shows, right? Violent video games, right? Religion, right? There are violence against specific religions. Okay, and then there's population as a whole, lack of jobs, What if you live in a community that has a high unemployment rate? Right? A lot of people are out of work, or they're in very low paying jobs. That's the only thing they can get. Leads to feelings of inadequacy, despair, social alienation, which can turn into frustration and violence. And then if you live in a community that has gangs, violence comes in a lot of different ways. Okay. And then the different communities that you live in. Some are more desirable places to live, work, and raise your families. Right. And they have facilities, resources that can reduce potential for crime and violence. Right. But some don't. You know, does your community have recreational facilities, playgrounds, parks, swimming pools? Right. So there's some diversional activities. Right. Acceptable outlets for a variety of feelings, including aggression, that you can get through having these support systems in your community. What if you live in a community that doesn't have any of these? All right. And then we also, you know, violence against ourselves, individuals or oneself. Right. Is it a homicide? Is it a suicide? Is it assault? Is it sexual violence? And then family violence. What is abusive? What do abusive patterns look like? What are types of family violence? Well, families, physical, sexual, neglect, child abuse. May have intimate partner abuse, abuse of older adults. Right? Well, how can we help? Right? So we can help by being educated enough to identify potential victims of family abuse, because nurses see clients in a variety of settings, such as schools, businesses, homes, and clinics. See it in the schools all the time. All the time. Provide interventions for each level of prevention for individuals, families, and the community. You know, the one thing we didn't talk about, it's not in our slide, but we talk about human trafficking. Would all of you guys be able to recognize a victim of human trafficking? Do you know what to look for? In nursing, as nurses, you're going to be working with victims of violence. It's going to be part of your experience. Okay, so here's your outline we just went through: work, education, media, right? Does violence against others or oneself? How does it look? Family violence. Okay, our objectives. Okay. Okay, define 4 general types of child abuse? It's in the chapter here: neglect, physical, emotional, sexual. Right? Describe the dynamics and signs of female abuse by male partners. Elder abuse, the increase of elder abuse in our communities. Okay. Healthy People 2020. Excellent, excellent list of objectives for reducing violence on page 434. Put this on a card. All makes sense. Reduce homicides, reduce bullying, reduce child maltreatment deaths, reduce sexual violence. I got to keep moving here. Okay, and then it goes through all the sections. Okay, you can read through these: work, education, media. Okay, so you can read through those, please. What kind of violence against individuals or oneself? It goes through a section of what is a homicide, what is an assault, sexual violence and rape, and suicide. Okay. I just need you to know those. I just need you to know what the four types of violence are. Okay, that we just went through. Okay, so what did we say? Homicide, assault, sexual violence and rape, and suicide. Okay? There's an objective about that. So if you can't answer, you're going to have to go back to this section. Family violence and abuse. Okay? I'd like for you to read this right here on page 440. This talks about how family violence develops. Right? Here's the development of abusive patterns. Okay, so read this section, please, as well. Development of abusive patterns. Okay. You have to understand how these patterns develop in order to be able to recognize these clients when they come to you. Okay. And then it talks about what types of family violence are there. There's 4. Physical abuse, sexual abuse, neglect. What's the 4th one? It's on our slide. Somebody go back to the slide that we just went
Is it
through.
emotional?
It was in the slide. I thought we just went through this in the slide, but I thought there were 4 of them. It was a slide that said types of family violence. I mean, I can go back there.
Is it emotional abuse?
Let's see. Let's see. Right here. Physical, sexual, neglect, and child abuse. Okay, so child abuse, intimate partner abuse, and elder abuse. Okay, so let's see. This is excellent right here. Abuse is about power and control. Excellent box to read. Okay, all of these actions are unhealthy and some are illegal. Go through, there's three topics. What does isolation look like? What do threats look like? What does intimidation look like? These are important to know because this helps you identify victims of abuse. Okay, child abuse, right? Same, for me, school nursing, I need to understand what the risk factors are for child abuse. I see it all the time. Okay, here's some questions to ask or observe. Are the parents unemployed? Do the parents have financial resources to care for the child? Do they have a support network? Critical questions. Does the mother, I can't tell you the number of times that I have concerns about kids and you think I can't get in touch with the parent. Nobody returns my calls. I want to talk about specific behavior. There's big red flags you can see. Okay, and here's another great box. How to potentially identify abusive parents. If you're a community nurse and you're working with the schools, you have to know this. Okay. So another excellent resource of just having an increased knowledge base of how to potentially identify abusive parents. Okay. And lastly, there's a great box here on how to recognize actual or potential child abuse. What do you have to be alert to the following? You have to be alert to these things. Unexplained injury, trauma to the genitalia, whiplash, dehydration, right? And I would think that in most of your work settings, at least for me, I have to go through a mandatory annual training that's because we're all mandated reporters, right? You all understand what a mandated reporter is, right? Somebody tell me what a mandated reporter is.
We see something, we say something.
Yeah, we're bound to that. Okay, so you have to be able to recognize symptoms. And as a nurse, at least in a community setting, people are relying on you, like in the school setting, if something's going on, whether it comes from a teacher, gym teacher, a classroom teacher, social worker, principal, they call the nurse, right, to help with the assessment. Okay. Intimate partner abuse, right? Most domestic violence is committed by men against women. But men are also abuse other males, women abuse other females. Okay, but intimate partner violence is defined as threatened, attempted, or completed physical, sexual, emotional abuse by a current or former intimate partner. Okay. And then here's signs of abuse. Okay, this is one of our objectives. Battered women often have bruises and lacerations of the face, head, and trunk of the body. Right? Attacks are often carefully inflicted on parts of the body that can easily be disguised by clothing. Right? What are the signs of abuse? Ranging from physical restraint to murder. Right? Hitting, kicking, punching, slapping, strangling. Right there. All this right here. Physical abuse. What could it look like? Any of these. Okay. And then the last part of this is battering during pregnancy has serious implications for health, both the woman and the baby. Okay. And it's a growing concern. Okay. Especially with teen pregnancy. Okay. And that's just a fact. And then, sorry, one other part I want you to review is I'd like you to review how to identify potential abuse of older adults. What might that look like? If you're going to be working with the elderly, long-term care, assisted living, I need you to understand this. Put these on a card. Because we do focus quite a lot on elder abuse in this class. And we have already, I think, talked about it. We've talked about it previously because I know we had a question on the exam about it, right? As far as, yeah, it was about elder abuse. So big concern. So please be able to identify potential or actual older adult abuse. Okay, what can we do? What can nurses do? Right? So primary prevention begins with our community approach that incorporates, let's see, who do we get involved? Maybe criminal justice, education, social services, community partnerships, and public health to prevent violence, right? And here's a good list of common, 6 of them, of some things communities have done, okay, to prevent violence. Excellent, excellent list. All right, so school-based curriculum that teaches children how to cope with anger and stress and frustration. Teach them communication and mediation skills. What a great idea. Family programs that teach parents how to deal with their children more effectively. Great idea. Preschool programs that develop intellectual and social skills. Put these on a card. Okay? Because if you're asked what would be some suggestions of the community pulling together and coming up with some primary prevention strategies to prevent violence, and remember primary, right? We're trying to stop anything before it happens. Prevention. Okay. Okay. I've already highlighted some of this, so I just want to let you guys know that the rationales for 25, 26, 27 are definitely worth your read. There's excellent, excellent knowledge to be learned in these 3 case studies. So let's go through it. And I know it's 229 and we still have 2 chapters left to cover. I'm not too worried about the last chapter. You can read through that. It covers the 4 main infectious diseases, the HIV, the hepatitis, STDs, and the 4th one. Anyway, if you end up having to read that on your own, that's fine. As long as we get through 25 and 26. All right, so Sarah's a school nurse and works in an educational complex that has elementary, middle, and high school. All right, she's responsible for 2,400 students. She has a medical assistant who helps monitor compliance with state mandated immunization documentation. Her role is primarily related to illness care and treatment of students with chronic needs. She also organizes all student and parent education related to health promotion and disease prevention. Okay, so she's been seeing this girl, 12-year-old girl, who's been coming in with really vague symptoms. All right, she comes to the clinic almost daily. And the nurses notice, remember the topic we're covering here, violence. Okay, she comes to the office almost daily, and the nurses noted a trend with the same time of day. She appears anxious and nervous when she's deemed ready to return to class. What problem could be suspected? Okay. Yes, I guess she could be seeking attention, I guess. She has ADD and lacks the ability to stay in class. Well, if she's coming every day, A, B, and C should have already been ruled out. So let's read through the rationale. Okay, the chapter is about violence. So we need to understand that one form of youth violence is bullying. All right, and it can occur physical, emotional, technology bullying, right? Bullying includes attacks of intimidation with the intent to cause fear, distress, or harm. Okay, so what this means is the nurse, as a nurse, you need to be able to think outside the box. If you know it's not the headache she said she's coming with, if you know it's not the stomach ache, it's been a month, she's coming every day, you probably should start looking for other issues. Okay, and knowing that youth violence, within youth violence, bullying is very common. Bullying is very common. Okay, and this whole rationale, please read question 1, rationale from chapter 25. This is an excellent synopsis of of a very common part of youth violence, which is bullying. So please have a read of this. Okay. Number 2, what is a primary prevention strategy? So that's an important question. That's a key word, right? What primary prevention strategies are useful for the school nurse to use to prevent violence? Okay, primary. So what's the answer? A. Right? What's B? What's B?
B is
Screening day.
secondary.
Right. What's C?
Is that tertiary?
C would be secondary, right? Because you're identifying, provide referrals to appropriate community organizations. So you've identified potential kids at risk. So you're going to give them referrals before it actually happens. And then what's D?
That's tertiary.
Why?
Tertiary.
Yeah, why?
Oh, because they're already being bullied.
Exactly. Bingo. Excellent. Right? So this rationale, again, gives an excellent synopsis of primary prevention. All right? And look, it pulled right from the book. What are some ways? Pulled right from the book. So it pulled from the book and put in the rationale. Okay, so what are some ways that the community group can work to prevent violence? And here's the list we just went through in the book. Okay, middle and next question. whoops, be on the next question. Middle and high school students participate in cross-country practice each day after school. A school nurse works with the cross-country coach to provide safety education to the students. What measures of safety education are taught to the students about reducing their vulnerability to violence? Select all that apply. Well, teaching personal defense measures, that sounds pretty appropriate. Teaching kids to monitor one another's safety, that seems appropriate. Should we allow students to carry pepper spray while they're running? No. Should we allow students to run away and go to any house for help? No. Right? But we might want to work with the community leaders to organize crime watch programs. Okay, so this rationale is also excellent. Highly suggest you have a look at it. Okay, it talks about how you can read the purpose of the question is how you can reduce, what measures can you take to reduce the vulnerability for violence? Okay, and it gives several suggestions. Okay, so take a look at 25's case study. Okay, I'm just going to show you about, because I don't know if we're going to get to chapter 27. So I just want to show you chapter 27 real quick. Chapter 27 is with regards to the 4 most common communicable diseases: HIV, hepatitis, TB, and STDs. Okay, this, I'm going to have you do 27 on your own. Okay, because the outline, which is the PowerPoint, goes through each. Okay, so slides 3 and 4 and 5 and 6. So 3 through 8 cover HIV. Okay. And then we have 9 that covers STDs. 10 covers hepatitis. And then 11, I think 11 covers TB. Okay. So you may be doing 27 on your own, but I just need you to know about each of those communicable diseases. Okay, and you can start with the PowerPoint and read the objectives. So, sorry, to read the objectives. Okay, describe the natural history of HIV and plan appropriate education. Discuss the signs of HIV, hepatitis, and STDs. Describe the scope of the problem and identify the groups that are greatest at risk. It goes through each of these in the book. Analyze behaviors that place people at risk for contracting these selected communicable diseases. And then what are the nursing actions to prevent these diseases and care for people who experience them? So this talks about primary, secondary, and tertiary. Okay, I'm just making that leap right now in case we don't get to it. Okay, so infectious disease and control. Okay, here's our objectives. We'll try and get back to those to make sure we answered all of it, but I kind of have these memorized, so I make sure that I'm trying to cover information that's going to help you guys be able to answer them. Okay, so we know that there's a worldwide concern about infectious diseases, especially we know people move from place to place all the time, state to state, town to town, country to country. So as people move from one place to another, they bring diseases, right? They bring levels of immunity and resistance to diseases. They bring viruses, they bring bacteria. They may harbor, they may be exposed to things that they're harboring and don't necessarily present themselves until they get in your community. I mean, what have we been dealing with for 2 years? COVID. It's all over the world. Talk about spreading. Okay. Don't need to know about historical. Okay. So what's the mode of transmission for communicable diseases? Well, what do we need? We need our agent, our host, and our environment, which is called what?
Epidemiologic triangle.
Awesome. Everybody remember the epidemiological triangle? Has to have an agent to infect a host. And depending on how that breaks out, the agent and the host, how sick people get, or depends on the environment. Right? What are some modes of transmission? Okay. We'll go through that in the book. Is it vertical, horizontal, common, or vector? What's a disease development? What's the spectrum? Is it endemic, epidemic, pandemic? I read something today that they think that they might be able to take COVID and turn it from a pandemic into an endemic by the end of 2022. So I read today. Okay. Let's put this on a card. Slide 8. What are the 4 emerging infectious diseases? Okay, what does that mean? Those in which the incidence has actually increased over the last couple of decades. And it's predicted to potentially increase in the future. This is your second attestation question. All right, so highlight number 8. So our 4 emerging infectious diseases are Ebola, HIV, a new strain of the flu, West Nile. Right, here's a nice slide that gives you a summary of primary, secondary, and tertiary with regards to the prevention and control of communicable diseases. Right, in primary, we seek to reduce the incidence of the disease by preventing it before it even happens. Primary. Secondary, right? We aim to prevent the spread if the disease once it occurs. So secondary, I always say early intervention, early identification, early intervention. And tertiary, all right? Let's assume that a communicable disease has now happened. What are we doing with tertiary? We are trying to figure out ways to reduce complications and maybe disabilities that are associated with the communicable disease. Right? Here's some agents of bioterrorism. You can look at that list. I saw something this morning too that, did you guys see that story that some vials of smallpox were found outside a lab in Philadelphia? Did you see that? I kind of was like, huh? So I don't know. What are some vaccine preventable diseases? Here they are. This is what we get our kids immunized for before they go to school. What does food and waterborne diseases look like? Salmonella, food poisoning, vector-borne diseases. Okay, what are those? Illnesses for which the infectious agent is transmitted by a carrier, vector. Lyme is your tick, right? That's the most common one. And then you have your parasitic diseases. And obviously diseases of travelers, right? And then you have your healthcare infectious communicable diseases. What do you think of when you think of that? I think of MRSA. What else do you think about with regards to healthcare acquired infections?
Hepatitis.
Yeah. Right. And everybody's heard about universal precautions, right? We teach that every day, all day. At least in the schools we do. Okay. So let's see. Okay, I'm on chapter 26 in the book now. I'm at page 455. Let's see. So here's our outline. Okay, transmission, surveillance, emerging. Vaccine preventable diseases. We just went through this. This is that's our whole PowerPoint right there. Okay, we have 8 objectives from this chapter. Okay. So let's hit it and see what we need to cover to be able to successfully meet our objectives. So Healthy People 2020, right off the bat. Selected objectives related to the immunization and infectious diseases. Okay, this would be a good little index card with the 4 objectives. Right, so for example, reduce, eliminate, or maintain elimination of cases of vaccine preventable diseases. Right, reduce chronic hepatitis B infections in infants and young children. All right, and then we have our epidemiological triangle. Right? What is the agent? The agent is the infection. So say it's COVID. The agent is COVID. Who's the host? Who's the host?
Us.
Us. And what kinds of factors in the environment may determine how the agent and the host react?
The environment.
Yep. Maybe have you been vaccinated? Are you elderly? Do you have comorbidities? Is your immune system healthy? Does that make sense? All those environmental factors are going to kind of formulate how that agent and host are going to collide. Does that make sense? Does that make sense, you guys?
Yeah.
The environmental factor right here, right? Physical, biological, social, cultural, right? All these factors contribute to what the transmission is going to look like. I don't know if you're healthy and you've been vaccinated and you get COVID, do you have a mild case because you're healthy and vaccinated and don't have any health issues? If you're not vaccinated, I don't know. If you're not vaccinated, you have comorbidities and you don't have a strong immune system, will you probably get sicker? Probably. Make sense? Or if you think of bug bites, I don't know. Think of the vector communicable diseases. I mean, it depends. The agent, the type of agent, the type of host, and the environmental factors all make up what's going to happen. Does that make sense? Okay. Surveillance. How do we surveil? All right. So first we have to surveil. So we have to find out who's infected, when they were infected, where they were infected, and what were they infected with. Right? And once you have all that information, then you can get to the why. Why did this happen? Right? So a good surveillance system collects, organizes, and analyzes current data for accuracy, for completeness, for a specific disease. Right? And then once all that is gathered, then you have a bank of information that you try and get out to the public who need it for effective, public health, who need it for effective planning, implementation, and evaluation, and disease prevention. Right? Where are all those words coming from? What does that mean? What words did I just use? What do they mean? It's the ADPI. So this is how you're applying your ADPI into infectious communicable disease surveillance. Right? Once you're collecting all the data, right? Then public health then you've done the assessment, then they plan for programs, they implemented, they evaluate it. Okay. And here's a good box. 26.2 is excellent. 10 basic elements of surveillance. Morbidity, mortality, epidemic reporting, investigation, lab reporting, surveys. Box 26.2 is a summary of what we just talked about right here. Okay. And then every state has a list of reportable diseases. For example, I know in the schools, I have a book. I know what I have to report to the health department. I know that chickenpox has to get reported. I know that pertussis has to get reported. I know that, I mean, there's a whole list. So be familiar with that if you're in community nursing. You know, there are certain diseases, certain communicable diseases that need to be reported. Okay. And then here's your emerging infectious diseases that we talked about. Ebola. Where are the rest of them? Sorry. Did we get to, there's Ebola, emerging factors, okay. I thought I talked about all 4 of those. Maybe it's in here. Lyme disease. HIV. Here it is right here.
Professor Marvel, they were in the PowerPoints.
They are in the PowerPoint, yeah.
Yeah.
So they're all in here too. They're in this table 26.2. You just have to pick them out. Lyme disease is up here. HIV is here. Okay. Influenza is here. And what's the 4th one? West Nile, right here. Okay, so all 4 are there. So in reviewing this box, review those 4. Okay, Lyme.
Now,
Okay.
I have a
No.
question.
Yep.
Is it the Lyme disease or Ebola? Because the 4 that are in the PowerPoint are Ebola,
Ebola.
HIV.
Yeah, I'm sorry. It's right here.
Okay.
Ebola.
Just confirm.
Yep. So it's Ebola, HIV, influenza, and West Nile. So as you're reviewing this 26.2, I want you to focus on those ones. Okay, I'll try and get rid of this. Okay, there we go. All right. So we got the 4 in here. Ebola, HIV, your emerging infections, influenza, and West Nile. Okay. And then this is a good section to read through as well. Primary, secondary, and tertiary prevention. Okay, with regards to, and as it says, as discussed in previous chapters, 3 levels of prevention in public health are primary, secondary, tertiary. This is an excellent summary. Okay, excellent. Okay, and then it goes into our box. It gives us what are some what are the disease prevention, infectious disease interventions with regards to primary, secondary, and tertiary. So I'd like for you to review this whole section right here. Sorry. Okay, like for you to review this section here. This reading that right here, starting on page 463, heading primary, secondary, tertiary. Okay. And then you can read the level about the levels of prevention. Okay. So we're not going to talk about agents of bioterrorism. I think that was it. I'm going to let you guys do the case study on your own. It's a good one. Okay, it's a good one. 25 and 26 are really good case studies. So I am highly encouraging you to review it. Okay, it talks about vaccines. It also talks about influenza, and it talks about Lyme disease. Okay, so those are the three rationales I want you to read about. So let's go. We only have 5 minutes left, and I really like to do my attestations at the end so everybody gets it done and it's one less thing to think about. So everybody go to your week 7 attestation, please. And for all of Dr. Lundy's students that came in late and didn't put their name and campus in the chat, do that before you leave because I have to center this attendance. Okay, what's the first question in chat? What's our first attestation question?
First question is, when discussing family violence and abuse, what are the signs of abuse? And it said hovering of the abuser, controlling manner of the abuser, inappropriate use of clothing to hide evidence of abuse, anxiety of victim around abuser, lack of interest from parents, lack of job of parents, excessive absenteeism from work or school.
Jane, was that you?
Yes.
Jane gets the gold star. Will you put that in the chat so everybody can use that? Because
I
we're doing
will.
this as a team.
Yes, I will.
Does anybody have anything else to add to what Jane said? And we should all thank Jane for doing all that legwork. Does anybody have anything else to add?
Thanks, Jane.
Thank you, Jane.
Excellent,
Thank
excellent,
you.
excellent.
There it is. It's in the chat.
Okay, there you go, guys. It's in the chat. So you can copy and paste that into your attestation. Excellent. Thank you, Jane. And what's the second question? I think it's the 4 emerging infectious diseases. Is that right?
Yes.
Okay, so what are they, guys? I'll start. Ebola. I'll start. Ebola.
HIV.
Okay, next one, HIV. Oh, it's in the chat from Ashley.
Now.
Yep. Yep. So it's in the chat. Thank you, Ashley. Okay, so as soon as you're done with that, just hit submit, just so I don't have to be hounding you about getting it done within 24 hours for everybody that's here. And I think Dr. Lundy, your students can do it too. You guys can do it as well, right? Because you're gonna have to complete it within 24 hours of the class anyway. And since you're part of my class, we can do the attestation together. So all Dr. Lundys can do it as well. I know we covered a lot today. However, good information. Just some feedback. Too much information. Is it okay? Do we feel like, I want you to go back to chapters 25 and 26 and look at the objectives and make sure you can answer those questions. Okay. How was today?
It was good. It was a lot of information, but some small things I've heard before, so it kind of helps put everything together.
Okay, good. Thank you, Misty. Thank you very much for that feedback. Anybody else? So for those of you in Dr. Lundy's class that listened to Dr. Apple's video, was this just a repeat or was this in addition to?
In addition to.
In addition to.
Oh,
yeah.
really?
Mhm.
Okay. All right, great. All right. Okay. Well, I'm done. So if anybody has any questions or anything they want to talk about, I'll stay on after. Otherwise, congratulations to everybody on your exam grades. For those of you I still need to get with, you'll hear from me. But for the most part, everybody did really, really well. I'm very proud of you guys. Really proud of you guys. Really proud of you.
Thank you. Have a
Thank
good
you.
evening.
All right, have a good Wednesday, it's hump day, so have a good rest of the week. And I will send you the updated, the only thing that's updated in the study guide is we took off week 9. That's it. We took off the 3 chapters, 7, 8, and 10, but I'll send that to you. Okay?
Thank you.
Professor Marvel.
Yeah, I'll stay on. So anybody that wants to go can go. Bye, everybody. Thank you for your time. Have a great day. If you need to stay on,
Are
stay
you going
on.
to send out the highlighted one? A highlighted?
No. No.
Okay.
No. I'm sending out a clean copy. No
Okay.
highlights. No highlights.
So the first week you sent out, was it highlighted? I don't think I could. Oh.